Good afternoon, good morning, depending on where you are in the world and when you are watching this. So it's a great pleasure to have you with us today here at this HIMSS session of the eHealth Summit of the Portuguese presidency. We have a great panel with us here today, and we're going to look at the changing paradigm of telehealth, the challenges and the opportunities that changing paradigm provides us. My name is Petra Wilson. I'm the European Programme Director at the Personal Connected Health Alliance, which is an innovation company of HIMSS. We've all been living through the pandemic longer than many of us had hoped would be necessary. The pandemic has accelerated the use and availability of telehealth in clinical care. In some countries, in fact, telehealth has become the principal means by which primary care consultations are being provided. This unprecedented adoption of technology to support social distancing and rapid diagnosis of infection was made possible by many changes that were adopted at great speed and under special measures. So we had special financial incentives, we had emergency regulatory changes. But many of these were, as the names suggest, emergencies. They were special, they were not designed for the long term. But we've all begun to see the benefits of the telehealth paradigm shift that we've lived through. The challenge is now, how do we ensure that the momentum towards telehealth that we gained as a result of the pandemic isn't lost? How can we make sure that the changes that we've made, the ones that we want to keep, are kept, and that we can continue to support patients in a way that they have now become used to and many would like to continue? How can we better integrate remote care, particularly of older people with chronic conditions, people who want to stay in their own homes? But how can we balance that also with new approaches of hybrid models of care? Nobody is saying that there should be no more hands-on or no more face-to-face care, but we do also need to think, particularly in times of financial constraints, about how we can make the most of new hybrid models of care so that we can deliver care in the way that patients actually want, in their home, on the move, in the workplace, working in partnership with informal care providers, be that family members or other healthcare providers. So what we want to do in this session is invite three panelists to talk about what they have learned about the responding to the challenges of COVID with remote care provision. We have with us Charles Alessi, who is the Chief Clinical Officer at HIMSS, and I will ask him to introduce himself more fully. We also have Catherine Chronaki, Secretary General of HL7 Europe Foundation and President of the European Federation of Medical Informatics, and Susanne Ozegowski, Head of Corporate Development and Digitization at the Techniker Krankenkasse in Germany. And they're going to run us through some of the learnings that they have made. And I want to draw your attention to perhaps the elephant in the room, because there's nobody here speaking about the legal challenges. And that's because we've already addressed some of those. On the 14th of May, we had a very exciting session again through the presidency, the Portuguese presidency, where we looked particularly at the legal challenges of cross-border care and telehealth in cross-border care. And we explored, for example, that the GDPR, which is the cornerstone of data protection legislation in Europe and the cornerstone of allowing health-related data to flow around Europe, that is a great start, but it's fragmented. It's not implemented in the same way in all countries in the European Union. And we have several challenges in making sure that data can flow easily and can support patient care wherever patients are. We also explored that there are many challenges still of liability. Our healthcare insurers, be that risk insurers or insurers providing for healthcare, don't yet really have the models fully in place for how to address healthcare delivered in a different jurisdiction by a clinician who is not subject to the rules of the country where the healthcare insurer may be sitting. And we also looked at upon the wider financial issues, and I'm sure Susanne will come back to some of these issues when she speaks to us. But at the moment in the European Union, an awful lot of cross-border care which uses digital solutions is confined to rare diseases through the so-called European Reference Networks for Rare Diseases. They're great, they're doing amazing work, but the ERNs are largely dependent on the goodwill of clinicians. Most countries do not yet have ways of reimbursing clinicians who provide care or support through the European reference networks. So we need to think about those challenges as well. But as I said, that was what we did a couple of weeks ago. Now, today, we're going to look at the particular challenges around what the clinical care providers need, what we need on a technical level, and what we need in terms of financial and reimbursement strategies. And I'm going to open the discussion now by asking Charles Alessi from HIMSS to open with a few thoughts on what we need in terms of supporting the clinical care providers as we move to new telehealth-based systems and how we integrate more hybrid systems. So Charles, over to you.
Thank you, Petra. I'm delighted to be here. Let me introduce myself. I'm Charles Alessi. I'm the Chief Clinical Officer of HIMSS. And really, I want to use my time really quite carefully because this is a really important subject. COVID has really transformed the landscape in terms of digitization and digital maturity. And suddenly we find ourselves in a place where these digital modalities, which in the past were really things which were anything but mainstream, have become mainstream. So the work, for example, around the rare diseases, which Petra alluded to, which is of immense value, is suddenly coming to its really coming of age, because the lessons there obviously can be applied to a whole host of other diseases. So where are the clinicians in all of this? Well, they were thrown into telehealth, which was adopted really quite rapidly and radically in a whole host of countries. And it became mainstream in most of the countries. And this is true actually globally, let alone within the European Union itself. And a lot depends on how it was adopted, and a lot depends on where the countries were before it was adopted. For example, we did some work at HIMSS and some research specifically in this. And in places, for example, which were not digitally mature, it could have had the effect of increasing the level of burnout amongst clinicians. However, in places where there was pretty good digital maturity, in some respects, it actually alleviated against burnout. I mean, if ever you wanted a story around the importance of digital maturity and being prepared for a pandemic, I think this is it. So really, we were put in a situation where I think the closest thing is a perfect storm, whereby suddenly digital modalities were the only way we communicated. But your specific question is where we're going to go from here, Petra. And really, I think it's very clear we have a lot of catching up to do. Of course, people with non-COVID conditions have had their conditions exacerbating over the last year, because even though we stopped to a large extent actually prioritizing the care of people with non-COVID conditions, their conditions obviously kept on deteriorating in terms of non-communicable diseases. So we suddenly have quite a lot to catch up on. And clearly the future is in hybrid models. And those hybrid models combine digital modalities with face-to-face. Face-to-face will always be there. We're not talking about replacing that communication between individuals, which is at the basis of the way we treat and assist people through a life course. But clearly, digital modalities also have a role. I've tried to keep myself to about 3 minutes, so I'm going to stop halfway to a degree. I could speak for another 20, so I'll stop there for the moment. Thank you.
Thank you very much. Thank you. And I think it's great to put it into that perspective of digital maturity and the fact that we need to catch up. And I think that then begs the question of understanding where you are in terms of digital maturity. We can perhaps come back to that. But Catherine, to turn to you, one of the issues of digital maturity is, of course, how interoperable are your systems? How are you going to rise to the wide challenges of interoperability? And I know, because I've worked with you for many years, that this is something you know extremely well. So it's a challenge for you to say a little bit about the interoperability issues in just a few minutes. Thank you.
Thank you, Petra. Indeed, I've been in the area of interoperability and standards for many years now, and sometimes we are frustrated at the speed of standardization. However, the digital acceleration that we envision has also taken standardization and interoperability by blast. We work together on the InStandards project, which as the years come by, I see was quite seminal in defining the elements of co-creations, governance, and alignment as key in the heart of making interoperability work. But what I would like to share with you today is that indeed telehealth for many years have been driven by technology. And like Charles mentioned quite eloquently, this has changed. It has changed because physicians and physician associations have been thrown into the melting pot of telehealth, of technology, of digital. And just to give you an idea of how telehealth has been unpacked by physicians and physicians associations that define the standards of care, the new standards of care, if we look at articles that talk about telemedicine in medical journals, only in the last 2 years, you will find more than 2,000 entries that speaks about guidelines that start from behavioral health all the way to ophthalmology. So how do we employ this tool to meet the need that we have? So yes, interoperability is at the heart of this new state of affairs, but it is not only about the technical systems. It is how the technical systems interact with the physical environment. So it's hybrid in many ways. It is in the way that you have telehealth and you have face-to-face visits, but it's also about the space requirements. It's about privacy. It's about acoustics. It's about lighting. It's about gaze angle and camera distance and the surface and what it conveys to the people. It is an opportunity, a clear opportunity that now the physician has to have some feedback from the actual living space of the patient. This is essentially very different. And it's not about the structure of the electronic health record. It's how you use and how you record this information that you capture. So just to summarize my position here, it's very much about medical guidelines now for telemedicine. It's about opening telemedicine and telehealth to the different disciplines and problems. And again, putting the patient, the citizen, the informal caregiver at the center and doing things like fostering access. Yeah, it's doing things about expanding hours and also measuring the impact of telemedicine by care outcomes, by understanding how to treat chronic conditions in this hybrid environment where you don't have episodic care, but you have continuous care, where you are relaxed and you have a different interaction between the health team and the physician. So it's about the well-being of the patients, it's about the well-being of the physicians and the healthcare team, and it's about new ways of interacting with technology. So technology-mediated interaction, information which is much richer, and we need to elicit from that what is important and how it relates to the actual guidelines of care. So it's a very challenging environment. We have very good practices, outstanding practices, and the health systems are facing a monumental opportunity to serve us. Thank you.
Thank you very much. You've provided some very interesting links there that I'm hoping Susanne might be able to pick up in thinking about this from the point of view of an insurer. The Techniker, Krankenkasse, I'm sure you will say a bit more, is one of the innovators in approaching insurance. And of course, you're from Germany, where we can really see some amazing new approaches in terms of digital health and legislation around digital health. So I wonder if you can share a little bit about the journey that you've been on in Germany. Thank you.
Absolutely. Thank you, Petra. And in fact, I can relate to quite a few things that Charles and Catherine just mentioned, but maybe just to say a few words on the Techniker Krankenkasse at first. So the TK is the largest health insurer in Germany. It's a public health insurance fund. And so we have around 10 million insured in Germany out of the 80 million people in population. And well, what we've been doing over the last years actually has been always to push for innovation in the system, and especially in terms of digital health. And that's actually been quite a tough business over the last years. At least, you know, when you look back 5, 6, 7 years, we've been mentioning digital maturity before. Digital maturity in the healthcare system in Germany is definitely one of the lowest in the EU. And so that it's been very difficult, and not so much due to technical problems, but actually more because of acceptance and the culture that we have, which is very much risk averse in terms of data protection, and not so much in terms of what are the opportunities. So actually for us, COVID in that sense has really been a blessing, because it's really changed something in people's minds, and both in health insurers, but also, and more importantly, I think in providers and also in patients. And so all of the topics that you mentioned, like the upsurge in video consultations, that's been huge in Germany over the past 12 months. We've come from basically zero to more than 1,000-fold change there in the numbers. When you look, for instance, to the numbers, I think like 80% of mental health specialists have all of a sudden started offering video consultations, which was something that before they would never want to touch, because they said this is nothing we can do, and it undermines our professional standards. So all of a sudden it worked, it's been something that has become a standard there in the last month, but also for other providers as well. And also for us as TK, I mean, we have started over the last years just with small topics like, for instance, online doctor appointments, which has been really, really difficult to actually push to. And now all of a sudden, this is something also that has really become a standard there. What has helped over the last years is that we had a Minister of Health, or we still have him, who's been very, very much also helping this agenda of pushing digital health. And so one of the things he has introduced, and which has just started in September, October last year, was that now we have a mechanism how to reimburse also digital health applications in terms of apps on prescription, basically, which is something that I think no other country in the world has so far. And that's, of course, really interesting, because, of course, we've had all those health applications before, but it's like most of the time it's been small startups, and for them it's been very, very tough to get into the market and try to get a share of the market. They had to knock on each insurer's door and ask for a contract, and many of them basically got lost over time because it just didn't work out, the whole business model. So now all of a sudden they have an opportunity to get into the market, and of course, you know, we're still in the first stage there, where now it's a very simple reimbursement mechanism, basically saying that if you have a prescription and you use the app, then the startup or the provider will get a fee for it. And of course, you can see, as we've been talking about hybrid models of care, this is just the first step, right? So what we have to do, I think, over the next years is really to come from this siloed reimbursement to reimbursement which well, first of all, reimburses more the outcome, and also which looks not just to the single provision of care, but rather to the whole process of care overall. So try to bundle, for instance, the app with what the provider is doing, making sure that your doctor who's prescribed an app is also able to see the data and do something with the data. And that's all the kinds of things that have not happened so far, but I think that's something that will come over the next years.
Thank you very much. And thank you also for reminding us about those challenges of doctors actually being able to see the data. And I just want to come back to a couple of the points that were raised in Catherine's background introductory discussion, because you talked about the needs for guidelines. And I also heard some of that in what you were saying, Susanne, about new guidelines for helping doctors prescribe apps or interact with the data. And Charles, I know you've had some experience on working on the development of guidelines. What do you think we need, and can we do anything at European level in terms of developing guidelines that help in the integration of telehealth into everyday healthcare systems?
Enormous subject, of course, and doing it at European level, of course, is even more complex, because basically you're trying to make central what is local to a degree. But putting that to the side, I think there is an enormous need for guidelines, because telehealth and teleconsulting is not intuitive. It is not simply a translocation of a face-to-face interaction. And we have actually dumped, I use that word because it's really the closest thing to the truth, clinicians into this, some of whom are really quite happy to jump in. Some others were scrabbling to get hold of something not to jump in, but had no choice. So we haven't trained people, and this is part of the issue. So guidelines are important, but in the context of training around the medical legal aspects of teleconsulting, what you can and what you can't do, what you should and what you should do, how you should manage data and how you shouldn't manage data. And clearly, I'm in company who understands exactly what I'm talking about in terms of these guidelines. But the other thing which I think is important is the context in which they sit within. And I just want to dwell on that and really pick up on something Susanne mentioned before, the reimbursement issue. They sit very well within systems which really take into account the way they're going to be used. And if they're going to be used in the context of life course around managing non-communicable diseases, your cardiovascular diseases, your cardiometabolic diseases, diabetes, etc., they really do make sense. But it gets a little bit more difficult if they're just dumped into a system whereby they are basically payment by activity, because then I think we're going to get into all sorts of difficulty around the implementation if we're not careful, as well as insurers could get into some difficulty. But that perhaps is not the subject of what we're talking about today, but we have to keep it front of mind, because I've seen so many initiatives starting on a really good path and suddenly go sideways because we haven't thought of something which is going to derail it.
Thank you very much. And sticking with the issues around guidelines, Catherine, I'd like to turn to you again. For many years, through HR7 and through other work that you've done, you've been trying to drive technical and semantic interoperability into the procurement guidelines for telehealth, trying to make sure that when people buy telehealth systems, whether that's at a national, local, or even at a private level, they know what they're buying and they know what they need to be asking for. How well do you think that Europe is doing on this, and what more do we want to ask the Portuguese presidency to really underscore here, to make sure that we do have interoperability at the heart of our systems going forward? It's a big question.
It's a big question, and I will try to handle the core of it. And the core of it is guidelines for procurement. And this is also a huge topic. I mean, we have the IHC profiles, but they are too broad. Think of guidelines for procurement that actually capture the core of what Charles said, which is how you actually pay for services, how you group services, and how you deliver predictable, high quality health services that have a hybrid component, face-to-face visits, remote visits, continuous care, and capture effectively the outcomes. Because we need to be able to capture outcomes if we really want to know what we are offering. So it's a quite complicated issue. Looking at it from a purely technical perspective, I think is wrong. And as I said in the beginning of my position, telehealth is no longer technology driven. It is needs driven. Yeah. And it's there to stay. It may be that we saw a rise in telemedicine during the past few months. There will be a drop, but this will certainly be above 10-20% of all visits. I expect them to be remote. And they have to be high quality. They have to have the apps. They have to have the e-prescription, but they also need to be monitored for quality.
Absolutely, I think you're right there, and maybe that's one thing that we can ask Susanne to comment on, because of course you've already been doing this perhaps before most other organizations in Europe, and if there's one thing that insurance providers know about, it's how to assess quality and reward quality where that's necessary. So how would you, what would be the one or two key lessons that you would really like to Europe to take forward, either positive or negative, from your experiences in Germany?
I think, well, one of the things was that we, I think what went really well in Germany was that we decided to go for instance, the apps on prescription, knowing that we will never have the same evidence level for them as we have, for instance, for pharmaceuticals, where for pharmaceuticals, you know, we do trials over 3, 4, 5 years, and then with a very high standard. And we decided that for apps, this wouldn't work because the methodology doesn't work, because they have much faster innovation circles. But nonetheless, we said, okay, let's just get started and introduce them into the system and give them reimbursement. And I think that's a way to go forward, to say, let's not just always look at the 120% solution, but look for an MVP and then develop things from there on. And I think that's a way to go for many aspects, I think, in terms of healthcare, actually, not just that. Yeah.
Thank you very much. And do you know, would you believe it, we're already almost at time. So I think that just leaves me with a very short minute to sum up some of the learnings that we've had from here. And I'm going to take it into sort of 3 words. Firstly, I think what we've learned is that we are in a state of growth. And it's not equal across the EU. It's not equal across healthcare specializations. So we do need to understand where we are in terms of digital maturity, so that we can build appropriately according to where any one healthcare provider might sit on that maturity scale. We've got to keep our eye on high quality, because however we deliver care, whether it's remote, face-to-face or hybrid, it has to be high quality. And I think the big lesson we've taken from what you've said, Catherine, is that is a whole system approach. There's no point anymore in talking just about technical and semantic interoperability. There's no point about thinking about telehealth as if it was something that was sitting alongside and separate to healthcare. It is part of healthcare, and we need to bring it into the healthcare family and address it in that whole system way, but recognizing that we're still on a path to maturity and not everybody is in the same place on that path yet. And I think with that, we've actually reached our half hour. and I'm really grateful to the great input that you've given us. And I would urge our viewers to take this conversation forward. 7th to the 9th of June, there will be the HIMSS 21 and HIMSS Health 2.0 Europe conference, and we will have, through the telehealth community, 2 further sessions which will explore this a little bit further, and we welcome you to those sessions. You will be able to find in further information to that in the chat shortly. Thank you very much for your engagement, and we look forward to seeing you again soon. Goodbye.